Adrenal drugs. The adrenal gland is made up the adrenal cortex and the adrenal medulla. Each portion has different functions and secretes different hormones. The adrenal medulla secretes catecholamines, that's the epinephrine and norepinephrine that we learned about in an earlier class. The adrenal cortex secretes corticosteroids. These are glucocorticoids or mineralocorticoids, but all adrenal cortex hormones are steroids. These drugs can be either synthetic or natural, and there are many different drugs and forms within this category. We have the glucocorticoids, the mineralocorticoids, and the adrenal steroid inhibitors, which are used to treat Cushing syndrome. Oversecretion of adrenocortical hormones leads to Cushing syndrome, and undersecretion leads to Addison's disease. Glucocorticoids. There are many different drugs. Some of them are listed here on this slide, and most of them should look familiar to you by now. They differ in how strong they are and how long they last, and they differ in the extent to which they cause salt and fluid retention, but they all do to some extent. Glucocorticoids inhibit the inflammation and immune responses. Because they do this, they interfere with the body's ability to fight off infection. They also mask infections that are there. If you don't have the red puffies around an incision site because you're taking glucocorticoids, you don't know there's an infection going on there. Glucocorticoids are given by inhalation for control of steroid-responsive bronchospastic states. They can be given nasally, and they can also be given topically. They can be given orally, and they can be given systemically. We do not give these drugs to people who are allergic to them, or people who have serious infections, including septicemia, systemic fungal infections, and varicella. We give it very cautiously to patients with gastritis, reflux disease, or ulcer disease because these tend to really irritate the GI tract. We give these drugs very cautiously to people with diabetes and to people with cardiac, renal, or liver dysfunctions. These drugs affect all body systems. So for the adverse effects, I'm going to refer you to table 32.4 in your text. There are fluid and electrolyte changes, such as hyperkalemia and hypernatremia. Please know what they mean and what the signs and symptoms are. But these two electrolyte problems can lead to edema, weight gain, hypertension, and heart failure. Glucocorticoids cause some carbohydrate intolerance, which means people get hyperglycemia and their diabetes gets worse, and because of all this sugar in their system, they're at an increased risk for infections. These drugs make people prone to peptic ulcer disease, and beyond that, they tend to perforate that ulcer, which is an absolutely life-threatening emergency. Skin gets thinner and becomes more fragile, and there's poor wound healing. It puts people at risk for osteoporosis and decreased muscle mass. So, what are we going to assess? Remember, These drugs affect electrolytes and serum glucose levels. Remember, they are anti-inflammatory drugs and they mask infections. Keeping that in mind, we're checking height and weight. Are they retaining fluids? You're going to see that in their weight. Is their height changing? If they've been on this for a long time and they're getting osteoporosis, they may be getting shorter. What's their I&O and hydration status? Again, are they retaining fluids? What are their vital signs, especially blood pressure? What's going on with their immune status? And again, let's look at edema and electrolyte imbalances. These drugs can be given systemically. They can be given orally, but we want to give them with food or milk to minimize their GI upset. We do give these drugs topically as nasal sprays, but you want them to clean out their nose, blow their nose before they use it, and that's before they use it. After using these sprays, orals, the inhaled type, they need to rinse their mouth out to prevent possible oral fungal infections. We're going to teach people to avoid contact with other people who have infections and to report any fever, increased weakness, lethargy, or sore throat. They need to take these drugs at the same time daily, usually in the morning, and they need to take it with food or meals or milk. And they need to not take them with alcohol, aspirin, or NSAIDs. Sudden discontinuation of these drugs can precipitate in an adrenal crisis caused by the sudden drop in serum levels of cortisone. Doses are usually tapered before the drug is totally discontinued.